Going last has its advantages and its disadvantages. Going after athletics, I know this is being taped. Probably the only people watching this are my mother and the task force. Everybody else has moved on to see what's going on. I do want to thank Dr. Nolan, Dr. Bishop, for allowing me the opportunity to lead this task force. What a great way to have some impact over the next 25 years, because one of the fun things about this is I'm pretty sure I don't have to implement a lot of these 25-year goals that's going to be happening down the road. Our task force was made up of people from all walks. We had people from both the faculty and the staff and all throughout the university, but we also had people who actually hire the people that we graduate, and especially in our health system representatives, and they really brought a different perspective to a lot of our discussion, which was really very, very beneficial. And I'd list them, but that would take me a long time. And I was given approval that my 10 minutes didn't start until I got off this slide.
You get 30 seconds.
Oh, well, my plan is now over. Okay. I did ask Dr. Bishop, I turned to her about 2 minutes ago and I said, please tell me this slide is moving just a little bit left and right. Because if it's not, I don't think I want to stand up. It is just a little bit. If you hadn't noticed that, now you're going to be focusing on that all the time. Let me talk about our charge, and I'm going to say one thing about our charge. Number one, we've focused on opportunities to distinguish the Academic Health Science Center. All those other things pretty much fell in line with that first charge. And our process, the process that we used, it turned out to be very, very well received by our task force. The first thing we did was allow them to stay in their silos. Tell me where your profession or industry is going to look like. What's it going to look like in the next 25 years? And then after that first meeting, it's like, okay, no more. No more conversation about your particular profession, your particular industry. We're talking about health sciences and where they're going to be. We used the sort of the future search process to try to get everybody to look forward. And there were some emerging themes that came out of that. New ways of learning, new clinical and delivery systems, competition. If anybody doesn't think we're in competition, I think we're mistaken. And research initiatives. Then that fell into the third meeting to where we started talking about new programs, interprofessional education, interprofessional practice, facilities and infrastructure, and research. We had some guiding assumptions that also related to really the framework for what we were working towards. These things kept coming up over and over again. And so anything we say in our report, anything that we talk about in what we're saying needs to happen in the next 5 or 10 years, these 4 issues were foundational. 1, interprofessional education, practice, and research. That was in every aspect of an Academic Health Science Center. You're going to see the word interprofessional so many times in this presentation and our report. And I know in pharmacy, the word interprofessional in the standards was like 3 times it was listed in the old standards. New standards in 2010, 27 times. Advancing technology, always looking at different levels of technology to accomplish what our goals are. Continuous quality improvement, wherever we are, we have to continue to look at different ways to do the work we're doing today. And then finally, this new business model. We came to the conclusion that the historic way of doing business in academia probably won't get us where we need to be in the next 25 years. And we're talking about being able to make decisions quickly, to understand that we're in competition, and also to be able to look around and see what are best practices and be able to implement those best practices as quickly as we can. Now, this is the focus of what I wanted to say. We have 5 things that we want to say that by the year 2036, the ETSU Academic Health Science Center will. First, be fully integrated in all areas of interprofessional education and scholarship. And I'm going to take just a minute and hit a couple of highlights on these slides. I'm not going to go over everything. But you see that we feel like that in academic health sciences, we need to focus on having common resources, administration, and leadership. And then we're really going down the road quickly on this next one. Faculty and staff who identify with the Academic Health Science Center first discipline second. And that's hard. That's really hard. And it's going to take a long time to get there. But if we're going to be world class, we've got to make sure we think in terms of interprofessional. And then potential of developing a school of basic sciences kept coming up. And that would take a long time to discuss that in detail, but it's part of our recommendations. And then finally, the last one I'll mention is there are a lot of things that are happening at ETSU that maybe need to be considered part of the Academic Health Science Center. I got a lot of emails and phone calls. Primarily they were, why am I not on this committee? I sent all those to Jeremy. But there's a lot of people that within the university that said, wait a minute, I want to talk about why my particular area is not in academic health sciences. So I think that's one of the things that needs to happen over the next 5 to 10 years. The second, exemplify visible collaborative practice model. We had practitioners in our group, and those practitioners said, if we're going to talk team-based, if we're going to talk having home care and the home care model, we need to show it. And if we're going to do that, we need to have some sites where our practitioners at ETSU all work together all the time. Don't tell the students something that they're not going to see. Show it to them, and then when they get out there, they'll make that happen. Include a College of Dentistry and implement other programs that meet workforce demands and enhance the practice and research capacity of the academic health science faculty and students. We came to a consensus fairly quickly that dentistry fits with the academic health sciences at ETSU. And that's a recommendation of our task force. And we'll probably talk about that during questions, I'm sure. But other things that we mentioned there's a lot of this long list of programs that we could start. And instead of going down that list of programs, what we came to was, and this was our people that hire us, if you will, came up with this idea. Why don't you do market research and make sure that what you're producing, people are going to hire? Ask us what you want. Ask us what we need before you say we think we know what you want. And actually, we were discussing particular profession, and one of our health system people says, well, you can train those people all day long, but I'm not going to hire them. That was pretty telling. And then that's basically why we're saying new programs, we need to do those very intentionally. Develop a research infrastructure with identified centers that allow faculty and students to excel in interprofessional education and transitional research. Transitional research, and our researchers were really focused on this. While bench research is critical, we'll continue to do bench research, but we may have a strength in translational research that can take our academic health sciences to the next level. And we can talk about that a little bit later. A lot of issues about research. Create identifiable space for interprofessional practice and research to fulfill our mission. And if you want to ask us to dream, the dream is that all of academic health sciences reside on a single campus, and that came out pretty strongly, which means there would be new facilities that needed to be added. And obviously, state-of-the-art technology. We talked a lot about technology and space, and that's the third bullet down. Let me stop there for half a second. Show the community that we all practice together. Show the community that the people that reside in the Academic Health Science Center, whether it's a hospital or clinic, a home or community-based setting, but there's integration where we show how people can practice together. Now, 5-year and 10-year kinds of increments to see if we're on track with all of our opportunities. In 5 years, we would hope that we'd be able to hire a dean for the College of Dentistry and implement a funding model. Obviously, there needs to be a funding model. We didn't take time to develop that funding model, as you probably would guess. Very specifically, renovate Building 60 on the VA campus, which is a building that currently is in disrepair and resides between the College of Medicine and the College of Pharmacy, that has all kinds of capabilities for interprofessional use. We can make this a reality with that. Tenure, let me jump to tenure. Graduate the first class of the College of Dentistry. Now, maybe that's really a pipe dream, but one of the things that we wanted to point out was this doesn't have to be a standalone opportunity for ETSU. Using the pharmacy model, I think Dr. Stanton's first attempt was to try a collaborative model. When that didn't work, then we decided to start our own College of Pharmacy. There are partnership opportunities that we need to think about that may have this to be a reality sooner than later. So that's one of the things that came out. Center for Translational Research operational. Our researchers said that's very important, that by the year 10, we have a center of translational research on the ETSU campus. Graduate students from the PhD in Rehabilitative Science program. And then finally, I'll just skip down to the last one because I'm done look. Establish Academic Health Science Center School of Basic Sciences, which is something that came out pretty clear from our researchers on the task force. I can't say good morning in 10 minutes. So we're done. I'll take a breath there. So questions?
Thank you. Larry, in conjunction with the College of Dentistry, since I am a retired dentist, and I spent a lot of time in the military working with dental programs, and speaking with Dr. Bishop this morning, I think the potential, we can make this work on the College of Dentistry if you change the format from what was originally discussed, somewhat, maybe a class of 40, cut it down to 20, and develop some type of relationship with the College of Dentistry in Memphis, or there's other schools, University of Kentucky. Well, I feel sure up in Lexington would be very receptive because I've given exams up there in the past. I think the potential's there. I think what you've got to do, though, is lay your framework, and the secret of this success is hiring a faculty and a dean. You have been successful dean of the College of Pharmacy, and I think that's one of the key things to make this program is get it off the ground with the right faculty. People that are trained, that believe in our program, believe in ETSU and what we've got to offer.
Well said. I think that when we started talking about dentistry, we could have talked a long time about dentistry. And early on, because of the research that had already been done with the task force that you're on, Dr. Anderson, it became clear, let's just go ahead and say we really want this to happen, but there's many different ways that it can happen. It doesn't have to be the traditional, let's start with building a building and taking years and years to do it. So that creativity is out there.
In talking about health science research, did your committee discuss at all regional issues, health concerns, and in particular, I'm thinking, when I think about my daily job, the science of addiction. In this entire Appalachian region, in Greenville, every 10 days we have a baby born addicted to pills. To my knowledge, no one's doing any studies about why are rates of addiction in the Appalachian region higher than other areas of the country, the impact of these children in 5 to 10 years have been addicted as a baby when they were born, later back. I don't think anyone's studying that in that research. And we're in the middle of it right here. We're in the belt buckle of the addiction. Did your committee talk about either the addiction or health concerns?
Absolutely. Thank you for asking that. I'll pay you for that question. Actually, translational research, meaning it goes to the bedside. It is outcome based. One of the things that especially our public health folks on the committee, when we said let's give some examples of centers of translational research, prescription drug abuse and prescription drug misuse, it was the first thing out of anybody's mouth. And actually there's a lot going on now that could come together and develop a center quicker than we think. If you go back to look at the 5-year recommendations, one of them is that we have 3 centers developed in 5 years. And I said, give me some examples. And prescription drug abuse was one. We're already doing some things on diabetes, cardiovascular, obesity, and I'm sure there's a list of others. But yes, that became number 1 on the list. So good point.
It's affecting the criminal justice system, the health care system for babies and children, foster care system. It's exploded.
Could you talk a little bit more about the Academic Health Sciences School of Basic Sciences? For those in the room who may not have a sense of the magnitude of that's impact across the College of Medicine and others, could you put a little flesh around that bullet?
I'd be happy to. Right now, all the colleges pretty much in the Academic Health Science Center have their own basic scientists that practice and teach in pretty much, this is the silo mentality. And the positive thing about starting a college of basic sciences where those people reside in one college and provide services out throughout academic health sciences, we've got some unbelievably talented faculty members that are teaching only pharmacy students or only medical students. And that collaboration is occurring in research now, but can you imagine the collaboration from an educational perspective, interprofessional perspective, and the research perspective if they resided in a college. Also, for long term, it has the ability to be a very cost-efficient model for providing basic science services to academic health sciences, both maybe even in some involvement with providing of services on main campus too, or undergraduate. And one of the things you saw maybe on our plans were the fact that we want to try to get our undergraduate community more in tune with the Academic Health Science Center and our colleges there early on, so we recruit them. We've talked about the 3+1 programs, and where they could finish 3 years at an undergraduate environment at ETSU, undergraduate, and then after their first year of pharmacy school, for example, they get an undergraduate degree from ETSU. There are colleges that are doing that now, and that opens up a whole bunch of opportunities there, along with our co-degrees. We now have PharmD MPH, MD MPH, and soon PharmD MBA. So we need to take advantage of that collaboration. But that is a big undertaking, especially if you would develop a dean and a structure for that.
You mentioned long-term that having the Health Science Center on a single campus would be beneficial. Can you talk a little bit more about the discussions in that regard, the vision?
Yeah, as you might imagine, we have medicine and pharmacy, we had public health, clinical rehabilitative health sciences, nursing, all represented on the committee. And pretty quickly everybody said, you know, it'd be nice if from an interprofessional perspective, if we're going to talk it, it's sort of like the clinical practice model. If we're going to talk it, we'd like to be residing on the same campus. Now that's the pipe dream. That's okay, where's it going to be? Can we build this huge building over on the VA? Somewhere else, Valley Brook. Dr. Bishop says Valley Brook's a great opportunity there. For my faculty that are listening, that was Dr. Bishop that was bringing that up.
Everyone's moving to Valley Brook.
Everybody's going to Valley Brook. Yeah, so that was the conversation there. It was like, they said, put it on the report. We would love for it to be there.
Dean, is that recommendation counter to the recommendation that other programs such as computer science, biological science, work closer with health sciences if you move them someplace else?
Well, I mean, it could be if you didn't do it the right way. Actually, I think from an interprofessional perspective, from the clinical model, it makes sense to have us all together. But we can't be separated from the university so far that we aren't able to take advantage of all of those things. And we had students on this committee. We had advisors. Martha Eddy was on this committee that talked about don't forget the undergraduate environment. So I think that it'd be a tough sell, but you got to make sure you don't get too far away from it.
Could you talk a little bit about the extent to which you considered healthcare reform generally and how that aligns with your planning process?
Actually, one of the meetings that came up, what are we doing in the next 5 to 10 to 25 years for healthcare reform? And the first person said, well, what is it? And what's it going to be? And nobody was able to answer that question. So we said, okay, let's ask it another way. How can we position ourselves to be more nimble to react to that? And one of the things that kept coming up is the medical home model and team-based and outcomes and those kinds of things. We've got to be ready for that. So then we kept always going back to the interprofessional educational opportunities. The detail for that as far as reimbursement, et cetera, if there's one word that kept coming up, second to interprofessional, it was partnerships. And everybody around the table kept talking about the VA partnerships as for space and clinical opportunities. Then we had both of our large healthcare systems, Wellmont and Mountain States, represented, and they talked about a lot of partnerships too. So we had our three major healthcare providers around the table. None of them could answer the question, by the way.
Lucy, I think did you have a comment? I know you thought you had.
I did. I was just going to say to Joe, we think the focus on building 60 and starting some of our interprofessional activity there is probably what's going to be most critical to helping us realize this. Related to the health reform, we've had a long focus on primary care. We've been recognized by George Washington University's #1 nation for providing primary care services. We have a doctorate program in nursing that produces nurse practitioners, and we have 10 nurse-managed clinics. So as we look at health reform, we do think we've got some of those providers that health reform is emphasizing, and that if we strengthen what we're doing with our professional work, then I think we're on the right track.
Thank you. I think we have time for one more question.
The funding model, and I understand what you said, you put that. My question is basically this. A year ago, the dental school assessment report was released. The assumption that report made where it said that to establish a dental school will require local and state government appropriations necessary to develop and operate an accredited dental school. We tried not to. We tried to avoid using local and state appropriations in our models. However, the lack of state and local appropriations in a community-based dental education model is non-existent. Dental education requires local and state support. Is that still, or is that the view of the task force or funding model? What is that funding model envision?
Okay. Before I came up, I said, Dr. Bishop, when I'm asked about the funding model, are you ready to answer the question? And I guess she is. I mean, she was ready.
We were able to get a lot of excellent data because the ADA does a wonderful job of letting dental schools across the country know what it costs to provide dental education. I think it will still involve some local or some state funding. If we look at a partnership model with the University of Tennessee, then that brings another perspective to the discussion, because then we wouldn't be asking the state to fund something in the West and something in the East, but we'd be looking at how do you make strengthen the program in Memphis while you're providing resources to Northeast Tennessee. One anecdote, and I believe it's in that report, was in the class of 2011, of the entering dental students in Memphis, there was only one who had a zip code east of Knoxville. So our students in this area do not have a source for dental education. And so I think as we develop the model, we've got to have advocates. We need to be creative. We do know we have some interest from Commissioner of Health, Commissioner Greisner, and looking at working with the public health system, which also fits with our rural mission. So will be challenging, but it will. I think it still will require some federal, state, and local. We can't do it on the pharmacy school model.
That was what I was going to ask.
Right, we can't do it on the pharmacy school model.
Okay, thank you.
Thank you all very much.
Thank you.